The member for Boothby.
Thank you, Mr Speaker. My question is to the Minister for Health. Will the Minister please update the House on Australia's vaccine rollout and what the Morrison government is doing to protect Australian lives and livelihoods and create a stronger Australia?
The Minister for Health.
Thanks very much, Mr Speaker, and I want to thank the member for Boothby, in particular for her advocacy for a national stillbirth action plan, along with members from right across both chambers, but also I would acknowledge the member for McMahon. So many people contributing to an extremely important outcome to save lives. Saving lives, of course, is what our COVID response has been about in Australia. All of the work being brought together by so many people across not just the chambers, but across the country. Today, we've seen one community case. Around the world, 439,000 cases. Today, fortunately, we've seen no lives lost, as was the case right throughout January. Sadly, almost 14,000 lives lost around the world and over 400,000 lost around the world in January. So against that background of a pandemic which is wreaking enormous damage, the vaccine becomes critical globally and in Australia. And shortly before question time, I was delighted to join the Prime Minister along with Professor Brendan Murphy, the head of the Scientific and Industry Technical Advisory Group on vaccines, to announce that Australia had purchased an additional 10 million doses of the Pfizer mRNA vaccine. That was built into the contract, the option of additional doses, when we prepared it and developed it. The advice which we have followed throughout on vaccine purchasing came from Professor Brendan Murphy's team, with Professor Paul Kelly, the Chief Medical Officer, Professor Alan Cheng, the Deputy Chief Health Officer in Victoria, and many other distinguished leaders in Australia. We exercised that option once the approval was given by the TGA, as was always the plan. And so throughout this we have been working to a plan on containment and capacity, and within the capacity element, working on the vaccines strategy. That strategy has seen us acquire now 150 million doses, three times that needed to vaccinate the whole of the population with 2 shots on each occasion. That is now 20 million Pfizer doses, 53.8 million Oxford AstraZeneca doses, 51 million Novavax and 25.5 million through the COVAX facility. Significantly, we have followed that advice, and it's very important that we continue to do that based on the best expert medical recommendations to the government. We'll continue to do that. The advice I also have today, both from Pfizer and from AstraZeneca, is that we remain on track for the rollout commencing in late February and early March, respectively, and this will help save lives and protect lives.